October is Breast Cancer Awareness Month, but there's a new report that indicates it is taking a long, long time to get screening appointments back to the level they were before the pandemic. Let's get into this now with Ashley Miller. Ashley is with the National Breast Cancer Foundation. Welcome back to Portland's Afternoon News, Ashley.
Tim, thanks so much for having us.
According to the information I saw, nearly 10 million cancer screenings were canceled due to the pandemic. Does that sound about right?
Yeah, it was about 90%. We saw about a 90% decline in those screenings. We're working hard, as a breast health industry to get back to those pre-pandemic levels. But the reality of it is we've just got to encourage individuals to get screened. I would just say if there's anything that people take away from our time today, it's if you're a female, prioritize your screening. All the reasons that we don't advocate for ourselves, the sports, the job, the family, the friends, those it won't be there, right, if we don't prioritize our health. And then if you're not of the age to get screened, encourage the most important females in your life to do that.
It's being said that despite the Biden administration's decision to declare a public health emergency earlier this year because of this, that it's going to take a long time before cancer services return to pre-pandemic levels, and that's got to be really concerning to your group.
It is, but the great thing about that is that NBCF exists to help women now. So we are in all 50 states, and our job is to remove the barriers to care. A lot of people think, well, maybe they're not going in for their screenings because of cost. It's not just cost, it's fear, it's misinformation, it's a lack of resources. And that's the great thing about NBCF is that we're meeting these individuals right where they are in their journey. You got to think it's everything from early detection to education, screening, diagnostics, and more. It's not just these women that maybe it's too late for them. If 1 in 8 women are going to be diagnosed in our lifetime, let's give them hope during that diagnosis, right? But what we know and what gives us hope is that early detection saves lives. So when breast cancer is detected in the earliest localized stages, it's 99% treatable and survivable. So it's just important for individuals to prioritize their screenings and to prioritize themselves.
We are talking to Ashley Miller from the National Breast Cancer Foundation about a new report that exposes a huge backlog of cancer screening appointments. They were missed during the pandemic. Ashley, I'm very interested in some of the roadblocks that you were mentioning earlier, things that keep women from getting a breast cancer screening. Let's talk more about that.
Yeah, NBCF exists to serve all women, right? So we're in all 50 states. We take a lot of pride in just an individualized approach where we can go into these hospitals, we can go into these medical facilities and say, how can we make the greatest impact in the community that you're in? We understand that not every community has the same needs, nor will they have the same impact if we just had a blanket approach to helping those individuals. So by doing that, we're allowed to give grant funding to these medical partners to make sure that the most women and families can be impacted, right? A part of that is continuing education. We got the flyover states where maybe there's just not a lot of continuing education for those doctors. But if you think about it, there's also very affluent partners that we have that maybe they have all the resources within the 4 walls of their hospital, but they don't always have an opportunity to get out into the communities that they serve. So one of the ways that we like to help those individuals is by funding mobile units or mobile mammogram vans that can go out into the underserved areas of the community that maybe they're prohibited from coming into the hospital. There could be a fear, there could be a language barrier, there could be a childcare barrier, maybe even a transportation barrier. So our job with all of our hospital partners throughout the United States is to get in and eliminate those barriers to care, no matter what they may be.
So what do you recommend a woman who's listening to this right now do if she hasn't been able to get an appointment?
We've got a mission at National Breast Cancer Foundation to ensure that no one navigates breast cancer alone. What I would say to that female and to anybody that's listening today, go to nbcf.org. You'll find out more information about how to get in contact with us. We can help you with our life-saving programs and services and come alongside you and navigate the entire breast health journey.
We've been talking with National Breast Cancer Foundation's Ashley Miller about this backlog of breast cancer screenings. Ashley, it's always good to talk to you. Thanks for the information. We appreciate it.
Thanks, Tim. You're helping us help women now, so we appreciate the time.